So what is my name and my position, and where do I practice? So my name is Dr. Omar Khan. I work as a consultant in medical oncology, and I work at the Great Western Hospital NHS Foundation Trust, and I also have a private practice at the Ridgeway Hospital in Broughton. So why did I decide to choose the speciality there of oncology? So there are a number of reasons. First of all, since I was a junior doctor, I very much enjoyed treating people who had cancer. I had experience of working in a number of London teaching hospitals, the Royal Free, Chelsea and Westminster Hospital, where I was attached to the oncology departments. I also had the great fortune of working with a really inspiring senior doctor who was my trainer, and she really inspired me and encouraged me to take this on as a speciality, because she saw that there was something I was interested in and I was potentially good at. I love the way that oncology balances good knowledge and understanding of science with good communication skills and being able to explain difficult things and have difficult conversations and challenging conversations with patients. Also, from a personal perspective, my mother had breast cancer in her late 50s, and I was a very junior doctor at the time. And so there was a personal element to my choice as well. Thank goodness she was fully cured and she was beautifully looked after by her oncologists. And that really inspired me to take oncology as a career. So where I grew up, so I had a really interesting childhood. I started off, I was born in the UK, in London, and at the age of 5, my parents, who were also both medical professionals, moved to Africa, to Zambia for a few years. So I was there for about 4 years or so, and had some time there in school. I really enjoyed my time there, partly because of the beautiful climate and the lovely Zambian people. And then from the age of 9 until I was 13, my parents moved to the Middle East, and I had a few years at school in Saudi Arabia, and I lived there for a number of years. From that point onwards, I then came back to the UK, and I completed my schooling in the UK, and then I've been here ever since. So based on some of the comments and the feedback that I've received from patients over the years, I think probably the things that patients would value the most about me is the fact that I give them the time that they need, that I give them a lot of, when I explain things to them, I explain things very clearly. I'd like to think, and often they say that I'm very empathetic, and when I have a consultation with them, a lot of my patients say is that even if the consultation only lasts for 5 or 10 minutes, they always feel that I've addressed all their concerns and all their needs. And actually, when I've had to spend more time with them, patients are always really grateful of how clearly I explain things to them. And most patients leave my consultations really satisfied. In terms of what I value most about patients, well, I appreciate that when someone is diagnosed with cancer, that's probably one of the worst moments of their life. And they come to me looking for answers. They come to me looking for a plan about what's going to happen next. And also they come to me looking for honesty. And I do my best to try and make sure that they get all of that from me, so that their journey that they're about to embark on, and even when they're in the midst of their journey, they feel they've got all the support that they need. And I think the main thing I have is that I like to think that I develop really good relationships with my patients, and I like to feel that I'm very approachable.